Gleason score, which for your audience here, for those less familiar with prostate cancer, that is a way to stage the severity of prostate cancer. Basically, what are we seeing under the microscope when we take a sample or a biopsy, in this case from the president's prostate cancer. And the Gleason score there is 9, which basically is 10 is as high as it usually gets. And so that is a severe, suggesting a very aggressive form of prostate cancer. The fact that there's bone metastases, this cancer has traveled to the bone, both puts the president at risk of fractures, and 2 is a poor prognostic sign. We typically 5-year survival rates in that setting with bone mets is about 3%. And yes, there's hormonal therapies like androgen deprivation therapy, where we're depriving the prostate cancer of growth agents that it needs to get bigger, like testosterone. There's hormone-based replacement therapies, or deprivation therapies rather, that we can use to deprive the cancer of these growth factors, of these growth agents, to shrink it. That's the hope here, that maybe this will be beneficial to the former president. But regardless, this is a difficult diagnosis, especially at 82. And typically speaking, once somebody has cancer evidence in the bone, metastases to the bone, that is something that's hard to walk back and completely cure. And that's the challenge here.
Now, we usually hear that prostate cancer is treatable if early. This cancer is metastasized. Do you find it unusual that it wasn't spotted before?
It's so hard to say that in a vacuum, because there's so much I don't know. To your point earlier, did he get screened with a prostate-specific antigen? Many of us, there's a lot of different guidelines on PSA for short screening. There isn't one sort of tried and true approach. If you have a family history of prostate cancer, Reverend, that's something that would factor into whether people get screened. Usually between 50 and 70 years of age, we say potentially consider getting a screening, but the recommendations are a little abstract, sort of a strong family history, which is to say that sometimes these prostate cancer can show up in a severe form because we aren't doing regular screenings in the years prior to a diagnosis. And so, no, this can happen because, unlike, say, mammograms for breast cancer or colonoscopies for colorectal cancer, we don't have a one tried and true approach, one standard set of guidelines to say everybody should get a PSA test for a certain period of time. So I suspect that maybe the president didn't get it in the years preceding this diagnosis because he was outside the typical age where you would typically get it. And so I'm not surprised that this came out of nowhere to some degree.
Would it have shown up in any blood testing?
That goes back to the PSA test, that prostate-specific antigen that referenced many. I strongly believe that if you have a family history, you're between 50 and 69 years of age, as a male, that you should consider getting this screening and have a conversation with the primary care doctor. It's important that every male that with a strong family history or between those ages of 50 and 69 have that conversation to get screened for prostate cancer. But this is something that certainly, if you were to get that test right now, I'm sure it's very high. But the question here is less about, what does that test now signal? Because it would be very high. But in the lead up to this diagnosis, was he getting these regular screenings? I don't know the answer to that, but I would suspect that if he had, it might have indicated or tipped his doctors to say, oh, should we potentially get a different type of screening test, like an image, like a radiology image, to see what might be happening.
Now, the statement indicates the former president's cancer may be sensitive to hormone treatments. What does that tell you? What kind of treatments are available?
There's one approach, and it's called, not to get too technical, but it's called androgen deprivation therapy. And in effect, what that means is prostate cancers, typically in men, need testosterone, the most common hormone in men, to grow and to get bigger. And the idea here would be, well, if we could deprive the cancer of that hormone, and there's many new ways to do that. There's a lot of new different types of hormonal therapies for prostate cancer just on the market just in the last few years that target different receptors that can actually shrink the size of the prostate cancer. So he has a form, evidently, that's receptive to these new forms of treatment, in some cases, older forms of treatment, which is a good thing. And so Reverend, I suspect that some version of this will be tried, and we'll see how he does. They tend to be typically well tolerated, so not a lot of side effects relative to, say, traditional chemotherapy, and they can potentially shrink the size of his cancer. So I think that they're going to completely cure him of the metastatic bone mets. Probably not. And so this is going to be a situation where can we maximize his functional status, how we can get him comfortable without symptoms potentially, because as I understand it, he had symptoms when urinating, and that prompted an exam. And then ultimately here we are. So can we get him to a point where he's comfortable, where he's not experiencing symptoms and potentially not experiencing any additional growth of his cancer? That is going to be likely the set of goals here in the conversation versus your full curative intent, which I think is going to be tough to do where we're at with these significant bone mets.
Now, Dr. Gupta, before I let you go, we already hear several people mention his age. Is age a factor in this? Because from my experience, you can have problems with cancer at any age. Is age a factor, or does it contribute to the alarm of this situation already being at a fifth stage here?
So I'd say two things to that. Age is a risk for any form of cancer. As we get older, we tend to see more cancers diagnosed just by pure fact that as we get older, we're at higher risk of all varieties of cancers. So that's one. But two, we often think about performance status. That's how we talk about whether somebody, how are they functioning? How are they doing? Obviously, former President Biden's performance status has been talked about with a high degree of scrutiny for the last 2 years plus in the lead up to the election. And for 82, there's a lot of different takes there, but I would say that they're going to look at his activity level, his energy level. How's he doing? And, he's independent in his activities of daily living. He could tolerate chemotherapy based on what we've all seen. And the question will be, to what degree for how long, what types of treatment, what are their side effect profiles? But there's no doubt you're at higher risk of cancer as you get older. That's just a fact. And that too, it's as we get older, it's harder to withstand treatment because we're just less robust than we are when we're younger. And so there's a lot of challenges here at 82 with this diagnosis.
All right, Dr. Ben Gupta, thank you for joining us. We may get back to you later. As the Biden family is considering treatment options after announcing the former president has been diagnosed with an aggressive form of cancer, well wishes are pouring in from throughout the political world. For more, we're joined by MSNBC's Yamiche Alcindor at the White House. Yamiche, what's been the latest you've been hearing?
Well, Reverend Sharpton, I've been talking to a number of people who are familiar with President Biden's thinking and the thinking of his family, and they tell me that he is considering a range of options to try to treat this aggressive form of cancer. They tell me that he is, of course, a fighter, someone who is ready to do all he can to be healthy here. But this is, of course, really devastating news for the president. He's at right now his home in Wilmington, Delaware, where he's loved to go during his times and weekends, even when he was here at the White House. I'm also reaching out and have reached out to a number of Trump White House officials. We haven't gotten an official statement from President Trump, at least in the last few seconds. We haven't had one, and we're still waiting for that. We expect a statement that's going to mirror in some ways what we're hearing from so many other lawmakers here in Washington, D.C., who know President Biden from his long career in politics. People saying that they are sending him well wishes, well prayers. We've heard from a number of lawmakers. I could even read some. You have Sarah Jacobs saying it's incredibly sad to hear of President Biden's prostate cancer, but anyone who knows him knows he's as tough as nails. Veronica Escobar, a Democrat who serves in the House of Representatives from Texas, saying, I'm sending my prayers for health and strength and a speedy recovery to President Biden. We know, of course, that President Biden has dealt with a number of tragedies throughout his life. Of course, we know he lost his first wife and his daughter in a car accident, a tragic car accident, when he was a young senator. And then later on in life, he lost his oldest son, Beau Biden, to cancer. So this is a president who has weathered a lot, and now he's going to have to weather more as he looks to see how he can treat this form of cancer. Reverend Sharpton.
All right. Thank you, Yami.
No doubt you've now heard the news about President Biden. being diagnosed with prostate cancer. It is just... I think what gets me about this is there are people who are, how should you say, loudmouths in politics, whether it's Don Trump Jr. or other people who have a blue tick on X or various different, I don't know. It is not possible for cancer just to affect you if you are red or if you're blue. That's where your politics sway. And I was kind of brought up, sometimes you have what is known as common decency, respect. I'm speechless by some of the reaction I've seen to the news of the president's illness. Absolutely speechless. I was just brought up that there were bigger things than our political differences. It would appear within the Republican Party or the MAGA end of the Republican Party, that's not the case. Any opportunity to make a joke, be nasty. All I would say is we've all lost people, I'm sure, who've passed away from cancer. I lost my mum through cancer. If you're in a situation where recently you found out that somebody close to you has been diagnosed with cancer, understand one thing, and I think I'm going to say this, is the loudmouths that you see on social media don't represent anything. Don't represent the Republican Party, don't represent America. They're just, maybe they are in need of loving the man in the mirror. And the only reason I say that is because that's where a lot of attention is right now, and it's sad. I remember when Rush Limbaugh was first diagnosed with cancer, I got absolutely castigated because I wished him good luck. It is on both sides, left and right. If somebody you don't like is ill just because their political opinion is different to yours, you don't wish them bad luck. You don't make a joke of it. You wish them all the best, and they really, really need every ounce of just strength in the fight they face. So to Joe Biden, we just say, sir, you got this.